You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us we have Florida's go-to implant dentist, Dr. David Sherberg. Dr. Sherberg, welcome to the program.
Great to be here.
So I know you brought a lot of photos, so we're going to get to as many of those as possible. But for people that don't know your practice, like who's the typical or even ideal dental implant patient?
Well, there are a few types of people that eventually become implant patients. And first and foremost, there are these folks that have been going to the dentist for years, and they just have had problem after problem: broken tooth, periodontal disease, infections, toothaches, all of these different things that have just been building and building, and they're finally to the point where they've spent a lot of money. These folks have bleeding gums, bad breath, broken teeth, toothaches, and for years and sometimes decades, they've been going to the dentist and getting these Band-Aid repairs. And now, after all of that, they're to the point where they're being told that their only solution at this point is to have a denture, and they're just not really comfortable with that. They think that maybe there's another option. Maybe the dentist that they're going to said maybe dental implants are an option for them, but they don't do them. Or maybe they've been told they don't have enough bone to actually anchor the implants in place. And as a result, they find me because we tend to handle those more complex cases.
Okay.
And for those folks, we can give them a full upper and lower set of fixed teeth that don't come in and out.
Nice. Now the denture wearers, you say? Yeah.
So there's another group of folks. Now these are folks that have had dentures for many years, and they've kind of adapted to it. You know, okay. They don't eat all the foods that they want. They can't bite into a corn on the cob or a nice juicy hamburger. And they've just kind of become complacent with it. They've just said, this is my lot in life. They're just not aware of what's available to them anymore. They've stopped going to the dentist pretty much ever since they've gotten a denture. They finally think, I'm done with this. For those folks, we can offer them a full set of upper and lower teeth that don't come in and out and are completely different from what they've been experiencing for years. I mean, to just be able to go through life and smile with the confidence of knowing your teeth aren't going to kind of fall out at any given moment, and go to a restaurant and be able to order, anything that you want: crunchy, crispy foods, French fries, a nice juicy steak, and not be worried that you're not going to be able to chew it. And especially if you've got company there, you don't want to worry about the kind of foods that you're eating. You just want to enjoy yourself.
I'm paraphrasing you slightly, but you seem to think you have like the best office manager, treatment planner in the world.
I know I do.
It's your wife, right?
It's my wife. I know I do. I better say that, right?
So she works together with you?
Yes, we work in tandem, hand in hand. Denise is wonderful because honestly I bring my work home with me. She's become very well versed in how all of this stuff works, and it's a really great way to kind of help patients through the whole experience, in the sense that they're going to be working with someone that completely understands the ins and outs of what I do.
So it's likely they will meet her at some part of the process.
Oh, absolutely.
Now, when most people think of Florida, you think of a very healthy area, right? Are there really a lot of people wearing a denture or headed to a denture?
You'd be surprised, Randy. There's a lot of people that are, I like to say, suffering in silence. You don't really know what they're going through, but you could fill Tropicana Field or even Raymond James Stadium with all the folks that are having these dental problems and really could benefit from dental implants.
Okay, so if it's so good, right?
Yeah.
If there's that many, let's say, would you say like 1,000 denture wearers?
Oh my
In the
God.
state, are there tens of thousands?
I couldn't treat them all. If you had every dentist doing this procedure, they couldn't treat them all. They'd be lines out the door, honestly. If everybody was aware of what's possible and how life-changing this stuff really is.
So if it's so good, why aren't they all doing it? What's your take on it?
There's a few reasons. First and foremost is the people that need it aren't really aware that it even exists.
Okay.
I'll be honest with you. People hear dental implants, they get kind of scared. I often get patients ask me, is this a procedure I need to be hospitalized for? The reality is this is not a procedure that people complain about from a pain standpoint.
Okay.
It's pretty quick, and at the end of the day, the results are very similar to their natural teeth, and that's what's so amazing about it. It's almost a perfect replacement for your natural teeth. I tell people that with confidence on a daily basis. I've never had a single patient tell me they regretted the procedure. So back to your original question of why everyone isn't coming to do this. let me tell you about the standard denture wearer and what their life is like. For usually from early on in their life, they've been seeing a dentist and having fillings, root canals, crowns, toothaches, just on and on. Things getting worse and worse and quite frankly more expensive. There's a reason people don't particularly like the dentist is because they get on this treadmill of constant work, constant expenses, and it never seems to be fixed. So by the time they're to the point where they need all of their teeth taken out, unfortunately, they're done with us. They say, I am not going to enjoy chewing anymore. I'm not going to be confident smiling anymore, but at least I won't need to see the dentist anymore. And that's...
So how old can you be to get this procedure as far as the higher end of age?
I've had colleagues that have done dental implants on people that are over 100. My personal experience is a patient in their 80s, mid 80s, 84 I think was a patient.
Why would an 84-year-old want to get new teeth supported by implants?
The better question is why wouldn't they? They just like you and I want to chew. They're still eating 3 squares a day.
Good point. Okay.
So I had a patient. She was actually a nurse. Worked in the Iraq War and very, very smart woman in her 80s. And she was starting to lose her front teeth to periodontal disease. And she just thought to herself, she told me this. She said, hey, I can go the rest of my life eating oatmeal, mashed potatoes, and pudding. Or in a few visits, you're telling me I can get teeth that I can chew like I was in my 20s, bite into carrots. With her, probably the only regret is that she thought she should have done this earlier.
Is this the kind of thing that like partners, husbands and wives do this together? Like one goes first, the other one goes second? That ever happen?
Yeah, it's actually really common. Usually one decides to kind of test the office out, and once they have a good experience, the floodgates open and you see the spouse right away afterwards, and they're ready to go. Because honestly, now their husband or their wife kind of has one up on them. They're at a restaurant and all of a sudden, you used to be ordering the same thing because you used to have the same tooth problems, and now, he or she's ordering a nice juicy steak and you're stuck with mashed potatoes, and you're like, I'm getting to the dentist, I'm going to get the same thing. I mean, Randy, I live in Florida, and a lot of these folks are retirees. They're out in the sun, and they're out eating at expensive restaurants with their new friends. And I'll tell you, all of them want teeth. They all want to chew. They're not running marathons. They're not doing that sort of thing. But when they go out to a restaurant and they can't eat the hamburger that everybody else is, or, eating the French fries or the steaks that everyone else is, not feeling that juice run down their throat or hit the roof of their mouth where a lot of your taste buds are, it really affects them. It really bothers them. I have this one patient. It was really interesting. He had a denture, and I made him a denture a few years ago. And he essentially was happy with it, or he says he was happy with it. Really, he was tolerating it like most denture patients, right? Then he came in one day just out of the blue and said, I need those fixed teeth. I need those teeth that don't come in and out. And I hadn't talked to him about this much. He must have, seen on our website or something that we do this sort of thing. And I asked him, I said, what changed? He says, I'm dating again.
Good.
Yeah, he says, I'm dating again. And you know what? If I go in to kiss a girl, I don't want to have a denture there. I want to have natural teeth. I want to feel that confidence. And I said, it makes sense to me. And then we did the procedure just in a few minutes, and you know what he told me? He said, this is way better than my denture in every regard. My smile looks better, I can chew, and obviously I can date and not worry about it. So it's been great.
What do they like more, what they can eat or how it looks?
What's really funny is that they'll come in for one of those. Either they want to chew better and eat all the foods that they used to eat, or they want to smile and look better. And inevitably, the folks that want to smile better, they're the ones that are commenting about how great they can chew all the foods now. Okay. And the ones that said, doc, I don't care how it looks, I just want to be able to eat, they're the ones that come in when all's said and done, and they're beaming ear to ear. They're updating their Facebook profile. They're doing everything to show off that new smile.
You say that, you see noticeable changes in their personality.
Oh, my God.
In their charisma. Really?
Oh, yeah. The telltale sign, and this goes for all of our smile makeovers, is that when we take our before photos, and I haven't coached them on this, when we take our before photos, they come in and they're just dressed in regular clothing. Their hair's maybe done up in a bun. These are the women now. When we're ready for the after photos, they've got full makeup on. They've gone shopping, new clothes. It's like a whole new them. And it just, like I said, it works for me because the final photos look better, but I never told them to do that. Most of the time, they didn't even know we were taking a photo that day. They just have more confidence, it seems like.
Yeah, but isn't it true, back to the denture wear? If you've been wearing a denture like 10 years, you probably don't have enough bone to do this. Is that correct?
No, that's not necessarily true. Maybe it was true in the office that the patient used to go to and with that dentist's experience. But I made an investment in a new technology called 3D X-rays, I call them, or CBCTs. They'll tell you how much bone you have within the millimeter.
Okay.
And we're able to place these dental implants inside of that bone within the millimeter. It allows us to place implants in places that we were never able to place them before with confidence. We can help people that we weren't able to help before, and maybe some other dentists aren't able to help.
Now, sedation. You're big on sedation.
Absolutely. We have a lot of anxiety with dentistry. We have a lot of patients in my practice that have, through years of the experience I talked about before, with the broken, missing teeth, the infection, the constant Band-Aid solutions, they've grown to just honestly fear the dentist, and that's understandable. We're there to honestly sympathize with them, and as a result, we do many forms of sedation. For dental implants, we'll also often employ IV sedation. And as IV sedation, you're given an IV, a needle in the arm. You know, you go to sleep, you barely remember the procedure, if at all.
So you're big on sedation.
Absolutely. It's a really important part of the process, in my opinion. Many of my patients are big on sedation too, because they'd rather not remember what's going on or realize that they've been there for a few hours. The sedation's going to help you feel like you've only been there for 5 minutes during the procedure. Of course, as with every procedure, we give you the local anesthetic, we numb you up. But I go the extra mile. I bring in an IV anesthesiologist, an MD anesthesiologist, another doctor who's there monitoring your blood pressure, monitoring all your vitals, and concentrating on making sure the patients are as comfortable as possible so that I can concentrate on doing the dentistry as well as possible, to be honest with you. I wouldn't do it any other way.
Okay. Now, most patients over 75, according to my Google search, are on 4 medications or more. Can you be on 4 medications? Can you be on blood thinners? Can you be on osteoporosis meds and still get dental implants?
Absolutely. It's often possible. In fact, I'd say it's usually possible. The key is that we do what's called a medical clearance. We are going to contact their MD, their cardiologist, whoever we need to, and I'm going to have a dialogue with them. I'm going to make sure, behind the scenes, I'm going to make sure that, all of our patients are good candidates and everything can be done safely. And sometimes we have to take them off a medication or add another medication or do whatever we need to do. But I would say the vast majority of the time we can do these implants no problem.
Okay. Now I put you on the spot in the green room over there. And I said, well, how many appointments? Like in the perfect world, if everything goes right, somebody's in their 70s, how soon could you take somebody with no teeth to get them to teeth? How many appointments? You said 3.
I said 3, yeah.
Possibly. Nice.
Yeah, and that includes the initial meet and greet consult. I mean, if things are going well, we'll take what we call records that day, send them off to a lab. We do another meet and greet where we, go over medical history and make sure the sedation's all set, and then we're rocking and rolling. We're ready to go.
Good. You brought some photos.
Yeah, absolutely.
Let's take a look.
So this patient, she came to me after she broke one of her front teeth. She had told me, I later found out that over the course of years, like I said, she had toothaches, missing teeth, broken teeth, become pretty scared of the dentist. And in her mind, just as long as her smile wasn't affected, meaning she could smile and see her front teeth, that was good enough. Well, she had to do a denture, and when I told her about, the fact that she would not be able to chew hamburgers, bite into apples, or things like that, quite frankly, be honest with her, she said, I'm not gonna have none of that. What else can you do for me? And I'm afraid of the dentist, and can we do it quick? So with her, we had the perfect solution. We figured out that we could put in 4 to 6 implants and then a whole row of teeth on top of them that are permanent, don't come in and out, and are going to be able to let her chew just about anything she wants. All the food she loves, all the hard, crispy carrots, cucumbers, hamburgers, whatever she enjoys, would be available to her. So take a look at the after. Now, the benefit of this is...
Very nice.
Yeah. Now, the benefit of this is, you look at the smile on her face. It's wonderful. You can tell she's genuinely happy. Not only is she chewing better, but, when you're confident in your smile, it shows. All of a sudden, those cheeks rise up a little bit further. You'll go from just hiding your smile, kind of guarding it, to beaming. And that's what we saw here.
What's it like when they look at their teeth for the first time?
Is probably the most gratifying part of my job, is because after all this hard work, they look in the mirror and all of a sudden their face lights up and they're smiling and they look at me like, you did that? And I say, no, we did that together, because they're a big part of this too. It's interesting because, her smile fits her face so well because we put a lot of effort in figuring out exactly what those teeth should look like way early in the process. We have this graphical smile preview.
So they get to see their teeth, what they're going to look like before you do anything.
Yeah. There's an
on a computer.
Absolutely. There's an art and science to this.
Okay.
Where we take a photograph and we will digitally create what their smile can look like. And they'll sit there with me and say, I like that, or no, those are a little bit big, a little bit long. Can we go whiter? All of that gets ferreted out right in the beginning. It's great. I actually, after we take these photos, I'm the one doing these smile previews, these designs. I do it myself because I think it's that important.
Okay.
I've been told that less than 1% of dentists do this level of smile design
with the digital
stuff. Absolutely. I find it just totally necessary. I would have to stop practicing if I couldn't do it. I've got another patient to show you.
Okay.
Yeah. This is Meredith. Meredith came to me with broken teeth, a smile that she just did not like. She didn't know why, but she just did not like how her teeth looked. I knew why. We went over her options. Of course, one of her options was a denture, and she threw that right out once I told her about her needing to use the paste or what she couldn't eat with it. Okay. And then we started talking about implant dentistry, and that not only would we let her chew better, chew the way she could back when she was in her 20s, but also that her smile would be drastically improved. Now look at this after smile.
Okay.
Those teeth are in the proper position. They flow right along her lower lip.
Okay. Is that computer designed or combination of you and the computer?
Like I said, it's an art and a science.
Okay.
So yes, the science part of it is the computer design. The art of it is just what looks good. Her initial teeth were also too long. They were too bulky and too long, and we had to actually shorten them and let her show a little bit more of her natural gums, which is what we did in the final, and it's just a much more pleasant look. You can see that almost in that before picture, she's kind of straining to smile. The teeth are just causing her to strain whenever she tries to smile. She's smiling without effort in the final picture. So look at the before picture and just notice the eye teeth, or her canines, and how kind of bulky they are and not part of her smile. Take a look at the after and the canines back and how everything kind of just flows into her
These
smile.
look like cosmetic veneers to me.
Yeah.
I mean, not that they look like real teeth, but it looks good. I'm not trying to side with you, but this looks good. She also looks more attractive because you told me that in the green room. It makes them better looking, but that's everyone.
Everyone. It's life-changing stuff. She tells me she's getting compliments every day on her smile. She used to hide her smile. Now it's an asset. Now she's getting complimented every day. She just retired. It's kind of like a whole new lease on life for her.
Are you ever on a consult? Because you told me you see the end result, like when you meet a patient. But are you ever on a consult? They're telling you their hard luck story, about all their and you kind of get excited because you go, they have no idea how good this is going to be.
Oh yeah. Absolutely. I'm just hearing, yep, we can solve that problem. Yep, we got that too. And by the time they're done, I hope they believe me, but I just say, we've got the solution for you. It's dental implants. Down the line, your chewing, your smile, all the things that you just told me you were having troubles with, we're going to be able to fix in just a few appointments. It's going to be life-changing.
Now, we have to bring this up because we'll get emails about this.
Sure.
But even the best dental insurance doesn't cover the procedure, maybe a really small part. Medicare, Medicaid doesn't cover it.
They're financing it though. They're
really?
financing
Okay.
it. Yeah,
Okay.
Something like 80% of people who go through this through with this procedure, they're going to finance it in some way. Those options are always available, and we can talk to you about that.
Now, you're not carrying the loan yourself. I mean, you have to have decent credit.
Yeah.
Now there's no excuse.
No, I personally don't think so. It's life changing. It's like I said, this is one of the most gratifying. I do a lot of stuff. This is the one I wanted to talk to you about because this is the most gratifying thing that I do. So this is Jane, and take a look at that smile. What's the first thing that jumps out at you? For me, it would be that you don't see any of her upper teeth. She's a denture wearer, and she often doesn't wear the denture because it's so uncomfortable. So when she smiles, it just looks unnatural. She just shows her lower teeth. She came to me. She said, "Doc, I'm in my 80s. I've been dealing with these dentures all this time. I hate them." So obviously one of her options was a denture, but that wasn't working for her. She already had one. She had one for decades and she hated it. So she was ecstatic that she had enough bone after we took that 3D scan. we found out that she had enough bone for this procedure. I think in her case, we put in 4 or 5 implants and a full set of fixed teeth on top of them, all in the same visit. And she left our practice able to chew pretty much whatever she wanted.
Let's take a look.
Yeah, look at this smile. Now this one's
nice.
funny.
That's
Oh
very
yeah.
nice. Okay.
Now this one's funny because I wasn't intending to take an after photo. She was just here for post-op, meaning after the procedure. You can see that she was smiling ear to ear. I just had to grab my camera and take a quick photo. I couldn't help myself. She was so happy with the procedure. The only regret she had was that she hadn't done this a long time ago. She was just so happy that she was still a candidate
So
for
if
it.
somebody she's in her 80s.
She was in her 80s, yeah.
So when you hear a 70-year-old say, "Doc, am I too old for this?" That's like young.
Oh, absolutely. I honestly, what I tell them is that by the time if we give you teeth now, by the time you're in your 90s and you're still chewing with them, those teeth will be of drinking age and able to vote. I mean, that's how long you will have had them. You've got decades left. Go ahead and have fun chewing with them, You're definitely not too old in your 70s. We clear all this stuff with their medical doctors. If their doctors tell us that they are healthy enough and they've got the bone, the implants don't care how old you are. They'll work on an 18-year-old, they'll work on a 90-year-old, just as long as, you're healthy enough and your doctor says you're okay for them. I had this one patient who had been a partial denture for years, and I had just met him. This is one of the quickest yeses I've ever gotten, and I had mentioned to him, he had been come from another dentist, and I was just talking to him. I said, "How do you like your partial denture?" He said, "I hate it. Can't chew anything." "Well, have you ever thought about teeth that don't come out?" And he said, "Yeah, but the other dentist said I didn't have enough bone and that I was too old." And I said, "Well, I'm not so sure about that. You're a young guy for this practice, that's for sure. And let's go take a 3D scan and see if you've got enough bone." Sure enough, he did. We ended up doing 4, I think in his case it was 6 implants actually, and a full row of upper teeth that didn't come in and out. You know what? He was so ecstatic that on the bottom, we started replacing those teeth with implants, and he knew the direction it was going, and he said, "I'm not getting back on this treadmill. You do another one of those on the bottom right away."
Good.
We ended up doing another one on the bottom, and he's happy as can be, and now he knows he's not going to get another cavity. He's ecstatic. Still a patient many years later.
We have about 2 minutes left, so I hate to rush you, but we're going to rush you a little bit on this.
Sure, no problem. Here's another patient of mine.
Okay.
This is Frank, and Frank was a nice guy. He came to my practice, and he said, "You know what, Doc? I'm a small business owner, and I've been in business for years. I've done great. I've been pretty successful by my standards, but look, I don't like my smile. The teeth, the color, the shade, whatever you want to call it, they don't look good. What can you do for me? I don't like the dentist. I know I've got a lot of different dental problems. I've been told in the past I have to see a bunch of different specialists, endodontists, periodontists, oral surgeons to get this stuff fixed. And honestly, I'd just be interested in something a little bit easier. What can you do for me?" And I took a look at him. I did a full exam. I diagnosed everything that needed to be done. And it turned out that I could just keep him in my practice, and I was able to do all of the work with just me using sedation dentistry. So we got it done real quick. Within a few months, he had a brand new smile. Take a look at that. Now, this is crown and bridge. We did crowns. We did root canals. We did some extractions, dental implants, and some periodontal work. That's 5 different types of procedures, usually with 4 or 5 different doctors working on them.
Okay.
And
so you were able to save their teeth?
Oh, yeah. In this particular case, most of these teeth we were able to save with root canals and crowns, but we did a few dental implants on them also integrated into the whole shebang. Yeah, so because I can do all these different procedures kind of at the same time, we get the anesthesiologist in, we sedate them. They're my only patient of the day.
Okay.
And I just organize it so I can do the root canal, the crown, the implants, all kind of at the same time, kind of working at once. So instead of going from doctor to doctor to doctor, I'm getting it all done right there.
Well, definitely looks good.
Yeah, he looks great. But you know what he told me? He's like, "I can now eat whatever I want, pain-free. Things were always hurting. I had all these problems. I don't feel like that anymore. I can walk into Ruth's Chris with confidence and order that T-bone that I've always wanted, and I know I can chew it and not have to worry about, this darn tooth back here, it's still bothering me." He's just living his life. He's living the dream, honestly. Down in St.
So
Pete,
no
Florida.
more dentures.
No more dentures, absolutely.
And we only have about a minute left, but like you said, people with bad teeth are judged, like in the movies.
Oh,
You
yeah.
want to make somebody look poor, you give them bad teeth.
Absolutely, it ages you. We got a retirement community, and the number one thing that my patients tell me is that I don't feel old, but my teeth make me look old.
New clothes, sounds expensive.
Yeah, it sounds yeah. All those new activities, that new lease in life can be expensive. Eating out at all these new fancy restaurants and ordering whatever they want. I'm assuming it can get pretty pricey, but I mean, look at the smiles. They're really happy with it.
So, in your opinion, nobody should be wearing a denture. Period.
Absolutely not.
You think it'll be outlawed, or not outlawed, but like let's say 30 years or whatever, dentures as we know them today won't exist. They'll all be attached to something.
Absolutely. I tell people it'll be like that metal hook that Captain Hook has when you lose a hand. You don't see those anymore because we got better technology. That's what dentures are. They're old technology that we're phasing out because we got something way better.
And so the days of the big bone grafting are kind of slowly going away.
Absolutely. We've got new techniques, new technology that allows us to fit implants in just the tiniest little bits of bone or in new places that we weren't able to do before. It allows us to skip a lot of the bone grafting. Not in all cases, but I would say in the vast majority, we're able to move right along past any of this long, complex bone grafting that adds both time and cost to the process. Okay. We're able to move right into the teeth.
And we have to mention again, you'll even discuss financing with each one because Medicare, Medicaid doesn't cover this.
They're not going to cover it.
And people are financing it more and more and more.
Absolutely. Some people pay cash, but we also have
financing. You
have to have
decent credit, right?
Of course, you got to have the decent credit. That's something our financial officer goes over, But you come in, we get a consult, we meet. We tell you about the procedure, maybe take some photos, take that 3D X-ray. And then we figure out if you're a candidate, and if you are, we discuss our fees and any financing options.
If somebody's watching this, and if you have availability on your calendar, how soon could you at least start the process?
We usually start very soon, within the week that we meet the patient. Yes, unless they need one of those medical clearances from the doctor or something like that, they're ready to go. We're taking records and we're getting the process moving because. People don't want to wait when they find out that they're a candidate and that this is something that that is going to help them, and that this is kind of the answer they've been looking for. They're ready to go, and we want to be right there to move on it.
And I got to ask you about the gums real fast.
Sure.
If you have bad gums, can you still do this? Will the implants stick in those gums?
Absolutely. That's most of who we treat.
Okay.
Yeah. So when the teeth come out, the infection goes with it. So now that bone is nice and healthy, and just as long as there's enough of it, and usually there is, when the implant goes in there, it's in a nice environment to become attached and allow us to put teeth on top of them.
I want to thank you for coming to the show. We're out of time. Good stuff. So if they want to make an appointment, they go to the website or they just call your office?
They can go to the website, learn a little bit more, but then definitely call our office. Yeah.
Okay, good. I want to thank you for coming to the show. Good stuff.
Hey, thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.